Karim Webers Mruya. I so happen to be working with the local government and it's Uganda district local government as the assistant district health officer in charge of environmental health. I know Benja wants me to have an attachment to my first qualification. Of course, I have a background in dentistry, and it's the reason he felt it necessary to be part of this uh, uh, part of this meeting, I may say. Maybe before we can go into the presentation, we need to know about the Busoga Health Forum. It's a non-government organization, which is a think tank for Busoga region comprising of all health professionals. When we talk of health professionals, people in most cases think about medical workers, but this is a forum which is having accountants, which is having lawyers, is having social workers, and many other professions, provided you are in Busoga, regardless of the tribe, because some people may think it's only Basoga who are in this forum. Is everyone living in Busoga is supposed to be part of the forum. And for the weekly webinars, it has been mentioned, every Friday we are here having assembly from 8 to 9. And we not only look at medical topics, so we talk now in most cases, we discuss a number of topics, but for today, we are so much interested in looking at restoring a smile for advance all health in Uganda. I think this may be the second topic since we started the CMEs. I remember I had one presentation in that line during the time we had COVID here, and I'm happy that today we are having someone to discuss about a similar topic. So as Busoga Health Forum, we do a number of things. We are into research, we are into MCH, we are into WASH, and many other things, HIV. So we are happy that we have everyone on board, and we welcome everyone on board. Then at an opportune time, we'll tell you that we subscribe. We have an annual subscription of 100,000 and 50,000, depending on your qualification. So thank you so much. Maybe back to Benja to introduce our presenter. Thank you.
Thank you so much, Doctor. And that has been a good introduction about Busoga Health Forum. Allow me to invite our moderator, Dr. Boris Mpeka, who will take it over from me. Thank you so much. Over to you, Dr. Boris.
Yes, thank you so much for the preamble. I do welcome all of you to this Friday session. First of all, because it has been a good Friday, a Friday where it has been having politics. For those who went through, we congratulate them. Those who did not, we ask you to try again. A healthy and thriving Busoga, which is our aim and what we hope for. We always think, always caring, always here, and your life matters. First of all, thank you for the introduction. Maybe before you go, I request you to give us a word of prayer, and we shall have the program continue. Thank you.
Do you want a prayer from me?
Yes, a prayer from you.
Let's pray. God Father, we thank you for this beautiful evening. We thank you for everyone who's on call today. And as we're going to have this discussion, maybe we may discuss, and all what we're going to discuss becomes better for our country and ourselves. I pray all this in the first thing in Jesus Christ. Amen.
Yes, amen. Uh, yes, so we shall have two presentations, although majorly one is for a main speaker, but at a later time before we allow questions, we shall have a 10 minutes short presentation by someone that I will request Makul Muhammad to introduce. But for now, we are going to go into today's session, today's topic, which is restoring smiles to advance oral health in Uganda. This topic is very important because the moment we get it very well and we understand it, because it's going to be presented by the qualified people, we shall have improved oral health and overall well-being. Of course, when that is done, we shall have our self-esteem and mental health improved. A better smile is equal to a better chewing ability. And when all that is done, we are economically and socially empowered. So it is not only about aesthetics, but it is a broader view. The person who is going to take us through this topic is the qualified person, and I'm sure as Busoga Health Forum, we had none other than a person who holds a bachelor's degree in dental surgery from Makerere University, a master's degree in prosthodontics from University of Nairobi. The gentleman who's going to speak to us is a lecturer or a teacher in the dental school in Makerere University. He's a prosthodontist. I'm not sure whether there is another one, but at least I know he's one of the first ones, and he's a prosthodontist at Elephant Specialized Dental Care here in Kampala, Bugorobi. And we are also privileged that the same person is the Education Secretary of Uganda Dental Association. So he's going to be speaking to us in the next 35 minutes. And ladies and gentlemen, you shall allow me welcome Dr. Kizito Umar to speak to us. Thank you so much.
Thank you, Boris. That's an interesting introduction. I think you've covered all the bases. I'm sad that my video, I don't know if anyone can see me, but on my side, I can't view that, maybe because I'm sharing. So I just hope that I'm visible. If not, I think the voice matters more than the visuals. So thank you so much. I want to thank the Soga Health Foundation for organizing this webinar with regards to oral health in the country. And I think I'll just give a simple topic just to talk about where we are as a country, but specifically since we are talking about oral health in Busoga, I will look at a few things when it comes to Busoga. So thank you so much. Thank you so much, Boris, Benjamin, for the introductions. And I'll be right on time. I'll use around 30 minutes to look at where we are, and then we can take it from there. So as introduced, my name is Kizito Umaru. I'm a prosthodontist, a teacher, but also I love humanity. Those are things that sometimes we overlook, but I practice here in Kampala, in Bugolobi and Faraday Road. And being in all those positions, I also hold the Education Secretary position, not General Secretary, as put up on the poster, for the Uganda Dental Association. So I'm privileged to be here, happy to be able to speak with you about raising awareness, but also discussing the challenges so that we can provide solutions for oral health. We can look at Uganda, we can look at Busoga, but definitely it affects all of us. So be it from the north in Karamoja or north east in Karamoja, all the way to West Nile, back to southwest in Kabale or Kisoro, and all the way to Mbale and the corners of the islands in Lake Victoria, we all suffer the same problems as citizens of this country. So I think we are going to look at the importance of oral health as majorly how it affects all of us. Boris was just talking about how it affects our mental health, how it affects our physical health, how it also affects our self-esteem, because there's so much more that oral health can do, because it's the first thing that someone notices on someone is their face, is their teeth, and the contrast between the dark skin that we have, or even the whites, be it the light pale skin or light skin that they are, the teeth will always show because they're white on a black background, or even if there's no melanin in your skin, there's still some contrast. So with that, we know that oral health is good and essential for eating, speaking, smiling, but also for emotional expression. Because if you notice that people without teeth definitely are going to have an issue with expressing themselves, you'll not see what they're saying. A smile will be hard to pull off, but also speaking and eating will be a very difficult situation. So there are some conditions definitely that either contribute to or exacerbate oral health conditions or something like that. Diabetes is one of them, but also cardiovascular diseases that we see in life. So oral health, as part of the importance, it also affects the ability to eat, sleep, socialize, and work comfortably. It mingles with the first importance, but here we look at how are you able to be around people? How are you able to actually be productive at work? How are you able to get a good night's sleep? Because if you have a dental pain, like some of us, some people have never experienced that, it really affects you as a person. So the general well-being, the self-esteem, those are some of the things that really come up as a challenge when it comes to oral health. So the WHO, which is a leading United Nations organization that looks after the health of the whole world now, it has a role that it has played in oral health. And then part of their key indicators have been recognizing oral health as a crucial indicator in general health and quality of life. So this is from the WHO. So if you look at general quality of life is actually affected by how good your oral cavity is, how the absence of pain, whether you have any oral diseases or something, because those are things that we all look at. Of course, it drew a global strategy that was taken to reduce the burden or the oral disease burden in especially developing countries. Developed countries have so many strategies that they're using in order to mitigate this. But in developing countries, where Uganda falls, we are still struggling. So reduction of that oral burden or oral disease burden is a very good strategy for the WHO. So amongst their strategies also is to have universal health coverage. This also includes oral health. So universal health coverage means that we should all be able to access a doctor or a facility that can manage our health conditions. And this wouldn't be as big as having a maxillofacial surgeon or having a prosthodontist at every level, but just having someone who can manage a dental disease, even if it's an emergency management, it's still good. So that's what the WHO is pushing for. Of course, we have some other neglected diseases, for example, cancrum oris, which is crippling up a lot when it comes to developing countries, rather. So there's still a big struggle as to some of the countries recognizing some neglected diseases and how to report them, because we don't have very good reporting mechanisms in developing countries. So we come to specifically the international body for managing dentists or dental-related concerns. So we have the World Dental Federation, which is the FDI, or Federation of Dental International, which manages, and it also looked at some of its mandate in terms of managing oral health or maintaining oral health. So right now we're working with the Vision 2030, which is looking at reduction of inequities in access to oral health, but also addressing the global burden of oral diseases. So in this, we're looking at integrated care, where we are promoting integration of oral health into primary health care, whole body health, which does not necessarily mean that your body has to be, you're neglecting parts of it, as much as we're looking at the non-communicable diseases, including cardiovascular diseases, the diabetes, and all the others. Oral health has also been termed as that. So we should also take care of our oral health. Advocacy has been put up where we're looking at integrating these into national digital health strategies so that we can have reporting, we can have management, we can have systems, we can have employment of the professionals who are going to take charge of managing oral conditions or oral diseases. Capacity building, which involves transfer of data and information, research, advocacy, and improving of oral or global oral health. Now, of course, we know that there's a lot of shift from the global north coming to the south now. That includes Asia, South America, and Africa. So there's a lot of change. There's a lot of focus on that. So as Uganda moves towards getting our information, our data up to par, we are going to look at what the World Dental Federation says about oral health. So let's look specifically at Uganda. This is a pull-up from WHO, where we're looking at dental decay or just dental disease in children. And this is just in Uganda. We're looking at 30.8% of all children have decayed teeth. And I think this is even an underreporting because I'm sure there's many more children, especially in rural areas, that are suffering from dental disease. Some might not show up to the dentist. Some make it through their first eruption of permanent teeth at 6 or 7. But there's those who don't even notice, or who would keep it, or who would not afford, or who are inaccessible when it comes to where they're supposed to seek healthcare, that would not even fall in this statistic. So that's something that is good to look at. But of course, add what we are seeing in the adults, which is dental caries prevalence of 30.8. Now that comes up to a 61.6. So if you look at 61.6 of the population having decayed teeth or dental disease, that is something that is alarming. Of course, period disease comes in next, which is at 23.1%. That's a gum disease. Dental caries is the cavities or holes that appear in teeth, whether small, big, breaking the teeth or causing pain and other conditions. Of course, at the end of the time or end of the day, it normally ends up into tooth loss because of the degradation of the tooth itself. So periodontal disease is the disease that affects the gums, which are the supporting or the foundation of the teeth, which might also include the gums, the bones, and also some other tissues, the fibers that connect the gums to the bone, or even the teeth to the bone. So, of course, if we lose teeth from these two conditions, whether dental caries or periodontitis, which is periodontal disease, and gingivitis, then we end up having missing teeth, which is edentulism. Of course, we realize that most of our population ends up extracting teeth. So someone comes up to your practice, even now we still see it. And so I've come to extract my tooth. Question is, how do you address someone, or how do you address something like that? Because it's not that all teeth that are painful have to be removed. Right now, we're getting into modern dentistry where we don't have to just take out teeth. We can also manage dental disease without taking out the teeth. So dental caries, like we've said, it's the most prevalent of the dental conditions that are seen. 80% actually of the children are affected. The other one was a broad statistic, which adds up to dental caries being 61.6%. But here, even in children, you're looking at 80% of the children Uganda not having or having dental disease due to limited care, some of them access to any care at all. Periodontal disease, like we said, but this is more common with the adults, but also we have edentulism, like we said. Now, it brings in some of these things that we see. For example, Vinyo. Most of us who are practiced in so many settings can see that you're going to see a child, maybe pre-6 years, where you're not going to find a canine, or even as they age, as adults. Now, some people are too aggressive. They'll see that these early tooth buds that show up, or even sometimes pre-mature eruption of teeth that come up when the child is just born, or nettle teeth that come up. The traditional healers would remove them, talking about bad luck, talking about the fact that the child will not grow, a child shouldn't have teeth when they're just born, or even just a few months after they are born. So when those are taken out, then we have issues or we have problems. Sometimes they dig so deep that they even take out the tooth bud of the permanent canines. It happens a lot with canines, but it can happen on any teeth that are in the mouth. So for most parents, even not having information like that can cause a child not to have teeth when they're older. So I'm going to look at Busoga. Still, it's more repetitive than it is, but at 4.5 million people, the health infrastructure in Busoga, I mean, I worked in Jinja for 4 years, where I had also postgraduate. So let's say 5 years. And that's from 2014, as soon as I graduated, I was posted to Jinja, which was amazing. But of course, if you look at the infrastructure that is in Jinja, that used to be my workspace, especially the lower one here. That is where I used to sit. My chair would be looking out on that. I think the other one is orthopedic ward. I don't know if Dr. Enotu is on the call. He would talk about whether his situation has changed. I left so much, but I don't know if the situation has changed. But this was my chair. Of course, I had a compressor in the room. I had a sharps box somewhere. The light, a few things that were working. My light curing unit is somewhere there. But of course, my colleagues used to work on chairs like what's up above. Sometimes they wouldn't work. Sometimes they would work. Sometimes it would be a little bit of a problem. We didn't have technicians. And most of the people would really rely on out of pocket. What could be provided by the government at the time before I left was just simple extractions. Of course, there's fighting with the politicians and all other people on what to get or how to offer the best care that you could. But that is what we had. Of course, we are talking about the cultural practices that are existent, looking at the Binyo, what I was talking about. So early or infant oral mutilation, where we are finding, especially in the canine area, in our settings, where some traditional healer got something close to a screwdriver and just plucked out the child's permanent tooth buds, but also the early tooth or the deciduous teeth in that area. So those are some of the things that we really need to address, okay? So we have limited access to dental care. We have equipment, limited, but also healthcare professionals. I think right now in Busoga, we might be having like 2 or 3 dentists, if I'm not mistaken. I think the numbers might not be accurate as of now, but I think we have 2. One at the regional referral, which is Jinja Hospital. I think there was one in Bugembe. There could have been 1 or 2 others, but also there is, okay, not 2. I think this is looking at Jinja, sorry, and not Busoga. I think Iganga might be having 1. I think all the other districts should have, but of course we don't have support supervision from the person who is at the regional referral. So it brings in issues, but also equipment, like I said. If you've seen my workstation, even this is when I returned in 2021, that was where I used to sit. So, but I'm sure a lot has changed. I know a lot changed with a few things that changed in Jinja. So even all other health facilities should have gotten some change in what they have. Economic factors. I mean, this is Uganda. Dentistry is not cheap per se. So you're not going to tell someone that doing a root canal treatment for such and such amount of money, which is going to save their tooth, is going to be an easy thing for them to get, or that little money for them to get. So we're looking at some of the people that are offering such treatments, which are not even in government-aided facilities, that create problems. But also I'm speaking of 2-3 years ago. Currently, I know Dr. Notu and his team even have interns and all that, some of the people that we train in Makere and all other tech training institutions that are helping to bridge that gap. So they're doing most of the work. I mean, facilities are trying to improve and all that. One single bottle of a dental material, which definitely doesn't work for some of the people. But of course, we've looked at awareness. Do our people out there know about dental diseases, dental caries? Are they educated on how to prevent disease? Are they educated on what they should be doing? I don't think that is done. We have a team, but most of us are stationed in Kampala. Once someone makes it as a dentist, they'll want to stay near the city. I'm happy that currently we have people who are stationed outside the city, which is amazing. I mean, the city, I mean Kampala, the capital city, let me qualify that, because the cities are bigger. Jinja is the city itself. But even with Jinja, you see more people wanting to be within Jinja and not going to further areas which are closer to the lake and things like that, which should even be helping more people than that. But that lack of awareness and education is really bringing us problems. Of course, cultural practices that I've talked about, poor oral hygiene, attitudes, and of course, we have all these myths in the community. Oh, when you go to the dentist, when you do a root canal, it's the most painful thing on earth. When you replace a tooth, it's not permanent. Such and such will cause cancer, this and that. So we have all these misconceptions in our communities that are really wrong. But if we look at the implications of all this as a problem, we have a high burden of oral disease. I mean, we've looked at 80% of all children in Uganda having at least a cavity somewhere. These are preventable diseases. Adults, at least 20% having periodontal disease, okay? Others, even oral cancers are now coming up. We might not have, I didn't look at the literature that's supporting cancers or oral tumors that are available in our region, but there's so much that we see in practice, okay? But of course, access to care. Do we even have access to these professionals? Do we have community-based initiatives that are trying to mitigate the dental disease? If we're looking at a health center 4, a health center 3, a health center 2, do they have someone who's going to educate people when they come for their immunizations, mothers, or when they come for their village meetings? Is there someone who is going to educate people about dental disease? Maybe, maybe not. But also, if there's someone like that, how do we access them? These cultural practices that we're looking at, herbs, I mean, someone will tell you, oh, when you go and bite on this, it will help you here. Or some of them are actually painkillers. I mean, I'm a believer of herbs. Some of them do help, but we don't have any research to talk about what these herbs are doing or what is the active ingredient in them. So if NDA is coming up with such things so that they can look at the active ingredient in all these herbs, then we can use them. But for now, some people might use herbs that a mother told them, or a sister, or a friend, or something like that, which definitely affect them in the long run, which is not good. So it's increasing the burden of these conditions to all of us. Now, what do we do as us? How do we address this? I mean, not everyone is going to sit on a Zoom call in Busoga to reach out to us. But of course, the ones who come for their regular visits will be informed. I remember my team in Jinja where we used to have sometimes, and I think the interns are now doing it with Dr. Notu, where you'd have a time and give oral health education every morning so that you talk to people. Of course, it was more of, because it was an extraction situation, it was more of post-extraction instructions, but then we would still add something more when it comes to brushing, your oral hygiene, flossing. Of course, you're going to talk to people and you're going to tell them about flossing. By that time, you could even tell them to use a small string from a banana, the bark of a banana plant, which is still doing the same thing. It could be a thread. I mean, it's not waxed, so it might tear the gum or it might damage the gum, but it's better than nothing. It's better than a toothpick. So those are things that we talk to people about. But we can also do that. Whoever is on this call can actually help to push that across. Of course, we're looking at the children. and if we looked at 30.8% of the children in Uganda having dental caries, then avoiding sugary foods is something that we can do. Most parents these days are going to, oh yeah, a child is crying. No, why don't you give them a snack? The biscuits are being manufactured like nothing. The chocolates and the sweets and all that. Of course, some of which we can't even control. The government just wants money and taxes. So we're going to say that, okay, let's reduce the production of these, okay? Night bottles and feeding. Those are some things that we can't control, but we can tell someone, if you're going to feed your child on something like this, definitely know that you're going to suffer with them later on. But if you do educate them about brushing, educate them about this, of course, night breastfeeding and night bottles should be stopped at some point so that your child can have some sort of control. Use a cup or something like that, what they can use to drink. Early detection of dental disease. I mean, I'm also seeing it in cancers. Forget dental caries, where sometimes you might even need x-rays to check some of these things. But we get a situation where someone gets a swollen jaw or something small, a lump on their face. And they're just going to talk about, oh, this is that, or someone is bewitching me, all this. But they don't even notice the changes that happen to them until something is so big that then they start moving on the streets collecting money. I mean, these are things that can easily be sorted. You come to a dentist, take a radiograph, in case you can come to a regional referral. Even if someone can't afford that once in a year checkup, just to come and we check, we do a cleaning and all that, can help with prevention of periodontal disease, can help with early detection of dental problems, can also help with or something like that, your wife, your husband, tell them, your neighbor, tell them that they need to come through, and then they can have all those detections. Some of them even make trips to the city through a parent or a child bring their parent for other checkups and all that. They should. If they want to come to Kampala, why not? But also Ginger has some of these things. And dental surgery has a practice in Ginger. There's, what is that, Smile? The one by the Nile. There's also that. I forget the name. Then there's the regional referral itself, and so many other health center fours and district hospitals that are there. So these are some of the places where people can go to and just have a simple checkup. Addressing also these cultural practices. You know, when we don't talk about situations, we let things just go whichever direction they want, but that doesn't help us in any way. Are we benefiting from that if we just keep quiet and don't talk about these problems? No. So the more we talk about them, the better it gets for us, the easier it is. And at the end of the day, the more we benefit from this. The children, I mean, we all know that the children are the future of this nation. The UK, I was just reading the news, was it today or yesterday, that the UK just lowered their voting age to 16 years of age. Actually, that was yesterday, I think. And of course, everyone is like, oh yeah, up in arms, a 16-year-old can't vote because they don't pay taxes, a 16-year-old can't do this. But you know, that's the future. I mean, we're all 16 at some point. But right now, we are facing the decisions that were made when we were 16 for now, okay? So if we're looking at children, how do we protect them? How do we keep them? How do we keep their oral health good? So that you don't have a child whose teeth were removed by a traditional healer. They're not going to blame their parents. But of course, it's their parents that listen to someone who had no idea what they were doing, okay? So there are some of these things that we are looking at that are not helpful, that are not benefiting anyone, but they're making our children lose out on all this. Early extraction of teeth. If you don't detect caries when the child is there, then you're going to have a problem, okay? Because this child is going to grow with maybe a few teeth removed. You'll have loss of space. Permanent teeth will not come in. Orthodontic treatment will be needed. I mean, there's so much that we need to do that really needs to be addressed, okay? So I think that is something that we need to address. So how do we look at this? Start oral care early, because this is what's going to give you lifelong health. as a teenager, you do not want to have a child who is going to be laughed at because one of their canines came up in the wrong place, or a premolar is growing on top of another because a deciduous molar was taken out because it was carious 10 or so years before. It doesn't make sense. Brushing their teeth, of course, daily with fluoridated toothpaste. Yes, I know we might not get all this, but we need to tell our masses that if you're going to get water from a borehole or a well from a river, it might not have fluoride. But how do you ensure that you get fluoride to your teeth? Because fluoride is one of the one of the few materials that can help in regeneration of teeth when it's been damaged. So if the teeth have been damaged, then the fluoride in the toothpaste can help with that. But if we see a severe condition, we can even still apply fluoride in the clinic. So if we assess and see that the child has a very high caries incidence, then we can put some more concentrated fluoride in the clinic. We can't do that when we don't see the child. The child has to start, okay? But this is the responsibility of the parents. Of course, when it comes to the adults, dental caries, the children still, dental caries, okay? Gum disease, this still ensures that the teeth develop very well. Monitoring eruptions. Sometimes a parent sees that there are two teeth that are appearing in the central area at 6, 7, and it will come out. But then you see a child who grows with one tooth over another and all that, and of course, the parents were busy looking for money, which is okay. But parenting still comes with so much. I may not be there yet, but it still comes with so much in terms of responsibility. You monitor a child, you look at them, how are the teeth aligned? Do you need some earlier intervention? I'm happy with parents that bring their children as soon as they see a tooth wrong, especially the mothers, and they will want to look at that. Then you can advise them that, okay, we can do something now. If we can't afford, let's pay school fees for them as we look for an option later, okay? Educational programs. We need to take all these out there. Schools, the parents themselves, dietary guidelines for healthy teeth, like what we talked about when it comes to fluoride. If you're looking at calcium, a good calcium diet, milk and all that, that will be very helpful for a child to grow healthy, okay? Especially during the formative years. I mean, all this time where the child just opens up, anywhere between 6 and most probably 14 or something like that, where they're growing so fast and there's so many changes. There they need to have all this supplementation to their food as much as they can. Community dental programs. Like I said, sometimes we have the humanity that we look at. We all sit in our practices. I don't know if there are some dentists on the call, but some of us sit in our practices and forget that there is something out there that you can offer. Even if it's a once in a month, once in a month is pushing it, once in a year situation, give back to the community. All that money that we make, sometimes it's good to just go out there, go for an outreach, teach some students, teach some kids and all that on how or what they can do, okay? So I think those are some of the things that we can do that would aid a lot in benefiting the masses themselves, okay? So offering free screenings and dental and fluoride dental treatments. There's so many programs that are out there that are offering that. So can we tag along and do better by them? I think that would be something that is very helpful. Now, the role of a dentist. Encourage regular dental visits. It might not even be a pediatric dentist, but just any dentist. Like I said, we don't need to have all the qualifications of a pediatric dentist, periodontal surgeon, maxillofacial surgeon, a prosthodontist, a restorative dentist. We don't need to have all those at every level. We can have still simple things that can be managed by a public health dental officer. That would still be helpful. Encourage intervention for misaligned teeth or even for cavities. The earlier we do it, the better, because this is going to benefit us. This is going to benefit our children. This is going to produce confident citizens later. And also the oral health is going to be essential for speech, nutrition, and the overall care for our bodies. So we come to restoration, replacing, and this would help in spinal restoration, which is the topic of our discussion, amongst others, of course. Restoring, you can have dental fillings. I mean, fillings can be white. We call them fillings in quotes. They are restorations because you've lost something, so we're restoring that. They can still be the silver fillings, like what you see here, as big as that one. It can even be as small. You can be a white or tooth-colored restoration. Any of them can be helpful in doing that. But if you've lost a tooth, for example, the situation in D, you need to replace your teeth because a lot of change happens in the mouth that might not favor a replacement later. Something as simple as a denture could be cheap, it can easily be done. I'm sure can easily be done. A crown to cover a tooth that has been really that is broken beyond the support of the tooth. We need to strengthen that by putting a crown on it. A dental implant, of course, those who can afford, those are new modalities in replacing of missing teeth. They can work. A bridge or something like that, what we call a bridge. All those can be used to replace the missing teeth. Using this picture, I think it was a cohort of students. I don't know which year this was, maybe a couple of years ago, 2 or so years. These were my students, and this was Makere. And this was a patient. Actually, he said that he wants his face to be out there. I got consent for this. And we managed him. If you look at the picture in the center, close to the center, to the left side of the screen, that patient didn't have teeth, but he was someone who was an instructor. He does a lot. He meets people. His business is literally interacting with people. But at the end, this is someone who was so happy to have teeth. Okay? So in terms of self-esteem, these are things that we ignore, but then affect so many people. So if we do that, then we should be able to look at that. I'm going to look at a few materials that we use at the clinic in Bugolobi where I work. And of course, we look at, this is now for children, even adults. Parents encourage your children to brush or to start brushing early. You can aid them, you can show, you can demonstrate, and you can let them do, okay? Those are some things that help with the children to learn how to keep their teeth clean. Of course, 90% of people experience oral diseases, like we know that. We now, of course, 60-something, 70, 80, 90, can be as high as that. Toothache can even lead to absenteeism in school. Oral health is linked to systemic diseases. If untreated, you can get even kidney failure if you have some of the bacteria transported into your kidneys. So those are some of the things that we really need to look at. Visiting a dentist every 6 months. But like I said, once a year is also fine. Eat a balanced diet, especially when younger, so that you can get all the nutrients. But also smoking. Those are some things that we don't look at, but they do affect that. Like I said, this is just some literature that we use at the clinic. These days, there's the power of social media. So you can put up something to educate your people. You might put up something on your WhatsApp, put something on your car, put something somewhere so that you can educate people. Brushing twice a day. These things that we think that we are treating kids and we are bribing them and all that, give them, oh yeah, let's go and buy cake. Let's go and buy this and that. Those are things that later on will actually affect them. So I'm looking at, are we benefiting the child, or are we actually getting them into a situation that we can't deal with? I'm sure there are a million people who open a bottle. I'll say beer, since it's a Friday night. Some people still drink a soda at some point. Now imagine what happens when you do bite into your tooth. I mean, into a bottle, and you break your tooth. Those are things that we really need to look into. Some of my friends in front of me, they'll still open a bottle. We'll find what to do. But I hope what you want is what we can do. Because sometimes the tooth doesn't show the right way it should. As I conclude, since I have a minute or so, I'm looking at how can we advance oral health in Busoga. Busoga can be replaced by Buganda, it can be replaced by West Nile, it can be replaced by so many. We are all in the same field. Improving awareness and education. This is something we can all do to our friends, to our families, your community, drinking buddies, anywhere. Building local capacity by training dental professionals. Right now, we're increasing the professionals that we're training, which is a good thing. Collaborating with NGOs, the government, for better resources. I won't say vote for the government or vote for NRM. I'm not into politics. But, of course, when you fight politics, you also have to put in an agenda. Go and tell them, yeah, these politicians who are coming here, tell them that we need a chair in dental in Jinja, or in Uganda, or in in Kamuli. Tell them what you need and get them at the time now when they can. They're going to make all these promises, they will not happen, but get them to commit and do something. But what can you and I do? Support these local initiatives if they can. Funding, equipment, sponsorship, if you can't avail yourself. Virtual consultations like what I'm doing. Sometimes it might be to a random person, but other times it might even be leading to a lot more people that you might interface with that will be very helpful. So you never know who you'll be talking to. Okay, raising awareness within the diaspora, even just in the community itself. How do we tell them that we are having problems in Ginger? Okay, so with all that, I think I'm within the 35 minutes. Dr. Boris, I don't know if I'm there, but that is a simple explanation of what we are having as concerns when it comes to dental and oral health in the region. Thank you so much for listening. Sorry, I took you very fast, but because of the time, I just wanted to cover all my bases, and then we can have a few questions, I think, after Boris has had another speaker. Thank you so much.
Yes, thank you so much, Dr. Kizito, for the well elaborate discussion. I'm sure everyone has at least gotten something or everything. Personally, I like the point about humanity, where you said even if we make money, it is useless if we don't support our community. Thank you so much. In the next 10 minutes, I request Mr. Makul Muhammad to introduce for us the next speaker before we can ask Dr. Kizito in case we have any questions, you can write them down. After this speaker, who is coming in, that is going to be introduced by Mr. Makul Muhammad, you will be able to ask your questions, and I'm sure he's going to be able to answer them.
Yeah.
Mr. Muhammad.
Yes, can you hear me?
Yes, please.
Yeah,
Yes.
thank you so much, Doctor, for the presentation, and thank you so much, everyone who is joined in. This is Mukal Mohammed. I'm the program manager of Communities for Childbirth International, and thank you for this time. Allow me introduce our colleague who is Korean, but studying much about dentistry, and she's currently doing a research in Ginger Hospital. Her name is called Uju Ko, but she will reintroduce herself and pronounce her name so well. But we are so happy, and you're welcome, our sister from wherever you are, to come and speak to the people. Thank you so much, everyone. Yes, please, we can hear you.
Sounds good. So, hello everybody. I am. Hello everybody. My name is Uchi. And this past June, I had the privilege to visit Uganda, Jinja specifically to for my oral health project as part of CCI. My name again is NG, but you can call me Ko, and I'm a dental student at University of Michigan. I had the privilege to visit Soga Health Foundation, and I'm very honored to speak here today. So a little more about Communities for Childbirth, who gave me the chance to not only visit Uganda, but also had introduced me to so many good people. There are a non-profit organization that works to decrease the delay of childbirth. So they are very close relationship.
Hello, Eugene, could you
Referral
amplify your
Hospital.
voice that people can hear you very well? Can you try to amplify your voice?
Oh, sure. Can you hear me better now?
You're still low.
I'm sorry, I'm in transit, but I'll make sure I voice up. How's this? So as part of CCI, I was able to work in my oral health project. And today I want to talk about what I did in Uganda and what I will be doing from now on. So where to start? Why did I decide to work with pregnant women and their oral health? So the first thing that I learned when I went to dental school, one of the first thing is that different stages of life can affect how your teeth is differently. For instance, when you're pregnant, you have increased susceptibility to dental diseases such as periodontal diseases, and if this is left untreated, this could cause consequences such as preterm birth and low birth rate. And not only that, if the mother has dental cavities, it can cause transmission of karyogenic bacteria to the baby if they share a spoon or if the mother kisses the baby. So knowing this, I was very interested in pregnancy and how they need to keep their teeth healthy in order for everybody in their household to have a healthy oral environment. And then when I was doing some research, as Dr. Gazito mentioned in his presentation, there was a lack of access in oral health services because there was only 0.1 dentist per 10,000 people according to the WHO. And there's a high dental disease burden where early childhood caries rate is 38.3%. And even with this high disease rate, there's not enough data to show which regions are the worst. And lastly, pregnancy in Uganda is also a difficult situation as well because only 5.9% of pregnant women receive adequate antenatal care. And why did I want to do this personally? It's because I feel like oral health is undervalued in global health areas, but it has a lot of promise. For instance, as Dr. Kizito talked about, a lot of oral health issues such as cavities and periodontitis is very preventable. So if we educate the people well, a lot of these diseases don't have to advance to a point where people lose teeth. And right now in the global health surface, there's a lot of emphasis on children and children only. And I felt that there should be a little more innovation so that we reach more population. Lastly, pregnant mothers can offer access to both children and the entire families, which could be promising. So what am I doing? I'm training 368 pregnant women and 43 midwives at Ginger Referral Hospital about their oral health knowledge and behavior and confidence regarding oral health related behavior. As Risotto Health Foundation emphasizes research, I also empathize with the importance of research because everything has to be evidence-based and we must know what to target before attempting the intervention. So with the baseline survey, my goal is to make an educational intervention where we can educate not only pregnant women, but also midwives. So before we can make the curriculum, we had a preliminary education session that talked about how pregnancy can adversely affect oral health. Both their gums and their teeth are more prone to disease, and how to modify the diet, such as decreasing sugar to decrease caries, how to brush properly, not only along the gum lines, but to make sure they target all the groups in their teeth, and how it is safe to visit the dentist during their pregnancy, and what to do after throwing up due to morning sickness, such as washing it out with water instead of brushing it right away. And we also talked about their babies and when and how to start cleaning their mouth, such as making sure they take a plain washcloth to clean their mouth even before the teeth is coming in, and the importance of baby teeth and how much toothpaste to use when brushing their teeth. When I was doing this education session, we had a very engaging session thanks to Betty and Hilda and Dr. David and Dr. Jude for participating in our session, and we were able to get a lot of questions. So these are the things that weren't included in our curriculum, but I am considering that it should be included because there were so many questions about one false teeth, which is something that Dr. Kizego talked about, where traditional healers take out teeth that is erupting because they believe it's bad luck or they believe it's causing the baby disease. My one challenge is to figure out how to fight the long-standing culture of belief as someone who works in healthcare. Second is what toothpaste they should be using, because that was also a lot of questions, and I thought it was a very good question as it was very practical, and the role of fluoride, because we kept on saying, oh, we need to use toothpaste with fluoride, but why? So I felt like that was a very important topic that we should touch on. So the future directions with where I want to go with this project is to finish the curriculum and conduct research on how effective this session was. And secondly, to educate the midwives and integrate the developed curriculum into the antenatal care so that it compensates for the lack of dental providers and we can leverage the regular AMC visit by appropriate members. So as Dr. Kizito was saying, I'm a very big advocate of community-based approach in terms of oral healthcare. So I want this curriculum to be enforced and implemented by many other community-based organizations. Some of the limitations that I see in my program is that this program is limited to hospital visitors, which means that we're missing rural high-need populations. So these are something that we should think about, and the sustainability of this program depends on an effective integration. Depends on if the midwives are willing to do the education, if the other community-based organizations are willing to take this in. Lastly, it's very prevention focused, which I love, but it does not address the existing dental needs, such as people who already lost their teeth or people with caries or types. And that is it on my end. I'm very grateful that I was able to speak today. Thank you.
Yeah, thank you so much, Miss Ko, for your observations and the advice you're giving to the people. I hope people have read. Some were not, were saying they are not hearing well, but at least the slides were very well seen and you're able to, to observe. So I'm going to take a few minutes to allow people ask. Maybe we can have like 3 or 4 people. I'm seeing some people already wrote in the inbox. As I allow people ask, I saw many people are thanking Dr. Kizito for the presentation, but Ampaire Ruth was asking what causes fluorosis and how can we prevent it? Then Mr. Patrick was asking that Dr. Kizito can kindly comment on herbal products like Nana mouthwash and if at all it has any side effects. Then Kasozi Andrew was asking about Evinyo. That is it, are they really there or it is a parental concern? Ladies and gentlemen, can I have also some few questions before Dr. Kizito sorts them at once? Kindly unmute and ask your question.
Hello.
Yes, Timothy.
Thank you very much, Dr. Boris. I'm also requesting, just add on the one who talked about herbs. Maybe doctor also could add also a voice, because I've also heard about people who don't use Nana, but there are some herbs which are sold on streets that people use, and sometimes it worsens the problem because they have that impression that they are treating the problem where they are not treating. So by the time they go and see the dentist when the problem is worse, so you realize that if they went early and instead didn't use herbs, maybe they would have got the intervention very early enough before issues worsen. So maybe doctor would also comment on that. Thank you.
Thank you, Timothy. You say hi to people in Mbale City. Any other people with a question? Any questions? Can we take those 4? Okay. In case they are there, you can write them in the chat. As Dr. Kizito uses, I don't know how he's going to compress this discussion in a few minutes. But Dr. Kizito, you have those 4 questions. I don't know whether I should repeat for you or you can answer as it is. Thank you.
I'm good. Thank you so much, Boris. So I'll start with, I think the first one that came up, which was from Ruth, looking at the causes of dental fluorosis. Well, we're lucky that in Uganda it's not as bad as our neighbors in the Rift Valley. We do have some in Kasese. I mean, some people who are living in Chenjojo. Not Chenjojo, yeah, actually Chenjojo and then Semlik. Bundibujo is the right word. So we don't have that as much, but the causes are usually a childhood or early exposure to fluoride, or a lot of fluoride in the system, which then causes problems to the development of the tooth. So when a tooth gets fluoride, instead of the hydroxyapatite itself in the development, then we get a fluorosis, which will not be the right strength of the tooth. So it will degrade, it will be discolored. So we have some problems, especially with the color of the teeth. It's something that also used to happen before tetracycline, where parents or mothers who take it during pregnancy would get. So that the biggest cause is an exposure to a high concentration of fluoride in the water, especially. So this is seen in borehole water, the Rift Valley areas, and things like that, water that is not tested. But most of us who use purified water or treated water by national water, that's not a problem that we have. Another question was with regards to Ebinyo, whether they're a myth or a truth. It's actually a truth, but the misinformation to the parents about neonatal or natal teeth is the biggest problem. So when they see a child getting teeth before 6 months of age, then they start worrying. So the problem with that setting is that you'll ask your neighbor, your friend, your previous mother, your father, your mother, your siblings, which will cause problems. So if only they come to the hospital, we should be able to do that. But it is actually true that they're doing this, and I think Ms. Cole mentioned that. So that is something that we look at. But there's so many studies out there that are looking at that. So we come next to the herbs. Definitely the herbs are not bad. The biggest problem is that we have no idea what is the active ingredient in these herbs. Some of them are just for pain management. So you take a herb, you put a clove in your tooth like the Indians do, it will definitely kill the pain. So it will numb the gum. The same one as what we do with eugenol. You just put a drop of eugenol there, it's the same thing. All these other oils that are put in the teeth and all that, that is the only thing that they do. Do they cure the dental caries? No. Do they remove the cavity? No, because this is something that is active and it has a different mechanism of how it's formed. So we definitely need to look at how we treat it basing on how it is formed. So the herbs, there's so many out there and so many people who will tell you what to use. Some of these people are maximizing on the misinformation of people and they're making much more out there, but which is not helping the community. So we really need to deal with that. But NDA is actually using that to sort a few problems out. So we might have some registered after looking at their active ingredients. I think I saw a question by Acheng Joyce after in the chat, who was asking recommendation for, or if I recommend mouthwashes. Now, naturally, your body or your mouth should be able to regulate its own pH. It should be able to keep its own normal bacteria. We all have bacteria in the mouth. It's normal bacteria which keep the gums healthy, which fight against other diseases and things like that. So we shouldn't be having mouthwashes or anything like that. But in case you have periodontal disease, gum disease, we do recommend a mouthwash you should use. So some of them then can it be used at that? So there's some regular mouthwashes that have maybe some hydrogen peroxide. Some of them have some alcohol in them that can just reduce the bacteria in the mouth. But remember that we need some of these bacteria to fight other illnesses and other viruses. So if they are not there in the system, then we have a problem. So I wouldn't really recommend a mouthwash unless needed. Maybe you just need some for having a fresh breath, but it's the same as a recommended chewing gum can do, like something that has xylitol in it. So it's things that we can use like that. Not that they'll have any benefit, but even harm. Sometimes they might have more harm than benefit to our bodies. Someone was asking, can a law be implemented? I think this is Dr. Yusuf, to prevent a vineyard like female circumcision because it's child abuse and mutilation. I guess there's politics that's involved here. So definitely there are so many things that can be done. But like I said, all of us sit in our practices. How many dentists do you know that are coming up in politics? At least now I know two. I think there was one of the dentists at Pandento in Nakuru and another one who just recently graduated, a very ambitious young lady. So there could be some people who are coming. I think she's coming up in March, India. Not that I follow politics, but there are some people who are going up to the parliament or any seats where they can help us to push for this. So we could be lucky. Our ministers are there in their offices. I mean, there are so many of these people, our politicians and councillors, they are there. So they could be helping in that. Now, because of time, I'm going to answer one last one, which is how do we go about halitosis? Halitosis is a very hard thing to treat in dentistry. Most times the causes of a bad breath are usually in the mouth. Most times, not saying that they're only causes, but most times those are the causes. Of course, we're looking at, do you have any cavity that is retaining food? A cavity is a hole in your tooth. If it's retaining food that you can't remove with your brush or floss, definitely it's going to smell because there's bacteria in your mouth that are going to degrade it. So that is something that we need to look at. Are your gums clean? Are your gums cleaned once in a year by a dentist? Do you brush and reach all the crevices on your tooth, around your tooth and under the gum? Because the gum doesn't sit on the tooth like a butt junction, no. It kind of creates a crevice where debris sits, where food sits, where bacteria sit, where there's a fluid. So all those things need to be looked at. Is your tongue brushed? Because the microstructure of a tongue has papillae, what we call papillae. They are like grooves, protrusions, and depressions in the tongue. If they are deep, the groove, the depressions and the papillae are so high, then they can retain food that might not be taken off. So if that remains on the tongue, that can cause that. But that's like 70% of the causes of bad breath. There are other causes that are deep-seated than what we see. Patients who have ulcers, patients who have acid reflux disease, they definitely belch some sort of smelly. Imagine you ate a Rolex in the morning. You also drank a cup of milk. You're going to have a lunch of matoke and beans and whatever, groundnuts and beef. Then you're going to have your dinner. But if you have acid reflux or acid reflux disease or even regurgitation of food or anything, even just gas, you're going to be having that coming back to the oral cavity. So that might be some other cause. But even people who have sinus infection or sinus inflammation, people who have some sort of pulmonary disease, which is lung diseases, all those can lead to a bad breath. So those are things that we need to look out for. If we can't identify something in the mouth as dentists, we've done your cleanings, we've done your fillings, we advise you on how to clean your mouth and things like that. Then the next thing is to go and see a physician, or even just your medical doctor, who's going to look at the other causes. They're going to do a full body exam and look at other things that will definitely cause that. So I think with that, just one last one from Hillary. I don't know if Boris will allow me. Okay, it's a minute to 21:10. So just 1 minute. There are some toothpaste that recommend for children. I wouldn't say that they're toothpaste, but these days companies are making age-specific toothpastes because of what is needed in a child. Sometimes you don't need so much. With a child, some of it has more fluoride than what is needed. And children are just children. We all were there. Sometimes you can swallow the toothpaste and all that. It tastes good. for some kids because they have no idea. But as an adult, you're supposed to spit it. So you then definitely get other things that you can recommend. So Colgate has some, ABC I think has some, but a toothpaste is just a toothpaste. So long as it has fluoride, me, I'm good to go. Otherwise, in so many words, Boris, thank you so much, and thanks everyone for listening. I think I'll hand over to you to close this webinar. Thank you so much.
Yeah, thank you so much, Dr. Kizito Omar, for your inspiring, impactful presentation. Your clarity, passion, and commitment to this public health, I know is going to give a lasting impression to Busoga and Uganda at large. Thank you so much, people, for listening. I'm going to request my brother to wind up and give the last remarks. I don't know whether he's going to, my brother Benjamin, if you are on, kindly give us a last remarks as we close this session.
Thank you so much,
Thank you so
Dr.
much.
Boris, and thank you so much, our presenter for today. This has been a very good presentation. I want to thank CCI for organizing this. And with that, I want to invite himself, the chief servant in Uganda, to give closing remarks and give certificates. Yes, chief servant.
Thank you so much. This was a very humbling presentation that has a lot of clarity, that has a lot of information for everyone to consume. And Dr. Kizito has done service to this presentation. Thank you so much, Dr. Kizito, for such a wonderful presentation. I wish there was a way we can have these presentations disseminated to the community. I want to challenge all dental practitioners in Uganda to take part in dental public health and to make sure that our children are safe. I'm a usual attendee of dental clinics. I know what it means to lose your teeth and the amount of money you have to pay. So I want to encourage the audience to take Dr. Kizito's presentation very seriously. I want to thank Ike Unjiko for coming to Uganda and wanting to design a model that integrates antenatal care, then oral health into antenatal care. This is part of the oral health policy that is actually as old as a decade ago. But unfortunately, I think across the country, this integration has not been realized. And I think it is very important that we take part in integrating oral health promotion in antenatal care. Thank you, Busoga Health Forum, for giving this platform a widely attended platform. I looked at the attendance, it went above 100. So Dr. Kizito, you had almost 2 classes or 3 classes of dental students in one evening. So your impact is that very great. And thank you, CCI, for the organization. On behalf of Busoga Health Forum, permit me to take the singular honor on behalf of Professor Peter Waiswa, who is the chairperson of the board of Busoga Health Forum, to award you a certificate, Dr. Kizito, for the wonderful presentation presented to you on this day, 18th July 2025. Thank you so much, Dr. Kizito, and God bless you.
Thank you so much.
Yes, do we have, yes, thank you. And I take the singular honor on behalf of Professor Waiswa, who is the board chair of Busoga Health Forum, to hand over a certificate to Dr. Boris Peka in appreciation of moderating this session and offering time to be around and ensure that Dr. Kizito gives his presentation without any challenges. So I hand you over the certificate. God bless you, Dr. Boris Peka.
Thank you, guys. Yeah.
Thank you so much, members, and thank you, team, for that good presentation. This is very insightful. I know we can always organize sessions and we come back and present our people. Let's meet next week as we continue to discuss more topics. Have a good night. Have a good weekend.
Thank you. Wish you well.
Thank you and good night.